So in this video, we're going to discuss the sacroiliac joint. The sacroiliac joint is the joint or the junction between the sacrum, which is the bottom part of the spine here, and then the ilia, which is the wing-shaped pelvis that we all can feel here that comes around into the pubic bone down here. So the junction between the spine here and then the pelvis as it comes round, we actually call the sacroiliac joint. Now the sacroiliac joint is a fantastically robust and solid joint. It's comprised of a structure of very, very strong ligaments that run the full length of the joint, together with tendons and muscles. Also the formation and morphology of the bone actually make it lock together in a really strong way. The function of the pelvis is to nutate and counter-nutate, so it'll rock forwards and backwards as we walk. So as the hip comes up, the ball and socket joint in the hip get to a certain point, and then the ilia will drop back on this side, and as I go into a leg extension, it'll drop forward. So it's going to move a little bit like this and this, but it doesn't move that much. Lots of studies and research have actually disagreed with actually how much it moves, but we know that it doesn't actually move very much at all. But it will move a little bit more than at other times in perhaps postpartum pregnancy, or when a woman is actually breastfeeding, because they produce hormones that will actually help relax the ligaments a little bit. But in general, the pelvis moves in a rocking type motion as we kind of walk, but it doesn't move too much at all. And so any dislocation of the sacroiliac joint or being out of alignment is very, 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 very rare and very unlikely, and really can only happen as a result of direct trauma, maybe a car crash or falling off a horse or something like that. So in the general scheme of things, it's very, very unlikely that you're going to materially affect the structure of the SI joint just through normal activities. That being said, it's definitely possible that the SI joint, like any other joint, can become irritated, can become inflamed, and over time can become osteoarthritic, which can be seen on an X-ray. Generally speaking, with the SI joint, its role is to help with walking and actually to help from sitting to standing. And so generally speaking, when we have pain in the sacroiliac joint, we're going to notice that bending forwards actually gives us a lot worse pain. We're going to get more pain from sitting to standing, and we're going to find that we get more pain when the actual walking. In clinic, what we generally find is that when we put patients on our force plate, we'll actually see that they have a functional twisted pelvis. Now what that means is they'll generally put more weight maybe on their front foot, on their big toe maybe on the one side, and more weight on the heel on the other side, and that will cause a functional twisting of the pelvis, which might give pain in the sacroiliac joint. But it's very, very rare that a pelvis will actually get truly twisted. It's more as a result of the way that you stand in order to compensate. And in all circumstances, the way that we try to resolve sacroiliac issues is, firstly, we want to reduce the inflammation to that area. And then secondly, we want to test all the muscles that have governance over the pelvis to make sure that they're all switched on. So your core's switched on really nicely, the muscles that rotate your hips and your glutes are switched on very, very nicely, the muscles in your hip flexors down the front leg are all switched on very, very nicely. And then we need to find the amount of loading that this area can tolerate in the short term before it starts to get irritated and inflamed. And we want to titrate underneath that by about 10, 15, 20%. And so we're always ensuring that you're able to exercise without causing an acute flare-up of symptoms.